All right, welcome everyone. Thank you so much for joining us for our fourth town hall. We are going to give everyone a few minutes to join us. While we are waiting, we're going to go ahead and get started with introduction. My name is Brenda Nunez. My pronouns are she, her, and ella. I work for Star Vista, and I am here as the co-chair for our Diversity and Equity Council. We do want to let everyone know that today's event will be recorded and it will be later posted online for everyone to view. We also want to remind everyone that we do have interpretation services in Spanish available. We will provide some instructions on the next slide on how to access those services.
Thank you, Brenda. Good afternoon, everyone. Thank you for joining us today for our fourth town hall event. My name is Frances Lobos. I use she, her pronouns, and I am also a co-chair for the Diversity and Equity Council. As we get started and we wait for other folks to join us today, we want to take some time to acknowledge and thank our planning group, beginning with Behavioral Health and Recovery Services Office of Diversity and Equity, Star Vista, the Bay Area Community Health Advisory Council, San Mateo County Public Health Policy and Planning Team, One New Heartbeat, the Native and Indigenous Peoples Initiative, the Latino Collaborative, Spirituality Initiative, and the San Mateo County Pride Initiative. Thank you all so much for your support. So I think we can get ready, Brenda, and go on to the next slide. Thank you. So as Brenda mentioned, we do have interpretation services available today. We would like everyone to please choose a language. If you could locate the icon, the globe icon on the bottom of your screen, please select English or Spanish. And you can do this as seen here. We also want to be mindful today. We want to ask that all our speakers today speak slowly and clearly to support our interpreters and be mindful of any acronyms. And just a final reminder, as Brenda also mentioned, this event will be recorded or is being recorded and will be posted on our webpage afterwards. Thank you. And on to some housekeeping items. All participants are currently muted. As I mentioned earlier, we will have time on the agenda for participation. At that time, we will ask you to please raise your hand or use the thumbs up feature if you're using a smartphone in order for you to be allowed to be unmuted. We will allow each participant to provide input for about 2 minutes so that we can hear from everyone. However, throughout the event, we want to encourage you to please use the Q&A feature to ask questions and also use the chat for any comments or reactions. We will also be providing information in the chat and sending materials after the event.
Thank you for those instructions, Frances. And to give everyone an idea of what today will look like, in a little bit we will get started with introductions and we will hear reflection from San Mateo County community members. May marks exactly a year since we hosted our very first town hall event. And our goal today here is to acknowledge and talk about the challenges and the growth we have experienced collectively as a community. We hope to hear directly from you today during our community dialogue portion. We will close the event today with some next steps and we will have a closing activity.
So good afternoon. My name is Maria Lorente Foresti. My pronouns are she and her, and I'm the director of the Office of Diversity and Equity within our Behavioral Health and Recovery Services. I'm honored to introduce Gloria Gutierrez, the wonderful creator and current co-chair of our Native and Indigenous Peoples Initiative that will start our time together with a land acknowledgement.
Hello, hi, I'm not sure if you can hear me, but I believe you can. My name is Gloria Gutierrez, and as Maria acknowledged, I am one of the co-chairs for the Native and Indigenous Peoples Initiative, and my pronouns are she, her, hers, and we are honored here today to be at this new place where we are acknowledging land for the Ohlone people here in this time that we're at. So I just want to say appreciate the invitation. We definitely, I want to acknowledge that these are the original people of this land, and we appreciate and we are honored that we are all here today, and we are acknowledging the Ohlone people. And thank you very much. Mateo.
Thank you, Gloria. I want to take a moment to let you all know about this picture before we get into the moment of silence and meditation. Over the past year, our workforce has lost special individuals, from those we serve and care for to our colleagues, family, and friends. We understand that the rituals we practice to support us through grief have been absent this year due to the pandemic. We also understand that these rituals can bring us comfort, reconnect us with those we have lost, and allow us to obtain support from others and begin our journey towards healing. To honor the lives of those we've lost and support our workforce in healing, we created a memorial of love during Workforce Wellness Month. We received approximately 150 names of special souls that have been a part of our workforce's lives within behavioral health and recovery services. With these names, we were told many stories of the laughter they shared, the love they shared, and the impact they had on the staff's life journey. This was a special project that named our loss and also voiced the beautiful things that these parents, siblings, spouses, clients, pets, and colleagues gave to us. On April 3rd, we created the Memorial of Love at the San Mateo County Phoenix Garden. The Native and Indigenous Peoples Initiative held a ceremonial blessing of the stones, and each name was read out loud. We hope that this memorial helps our workforce heal, to find comfort that their loved ones' names will be remembered and read by those that visit the Phoenix Garden. It is now my pleasure to introduce Mr. Bill Cruzy, who is a very special partner and previous co-chair of our spirituality initiative with Behavioral Health and Recovery Services.
Thank you, Maria, and welcome everyone. I am Reverend Bill Cruzy. He, him, his are my pronouns. As Maria says, I'm a consultant with the Spirituality Initiative, which is a part of the Office of Diversity and Equity of Behavioral Health and Recovery Services. It is important for each of us as a part of our ongoing experience to pause as we grieve or lament and reflect together as a community in addition to our individual expressions. Rabbi Corey Helfland of Peninsula Sinai Congregation in Foster City, who is one of our leading faith leaders in San Mateo County, agreed to lead us in a shared meditation. Rabbi Helfland.
Thank you, Reverend Bill, and good afternoon to everyone. My name is Corey Helfand. My pronouns are he, him, his. It's really a blessing to be with you all this afternoon. We're going to start first with a pause to enter silence that is filled with many emotions, and also to pause and reflect and breathe. And as you do so, I want to invite you to meditate on the following words. May my breath be returned to me in loving kindness. May my breath help me feel safe in moments of stress. May my breath sustain me in moments of anxiety. May my breath be a source of compassion. May I feel my breath throughout my mind, my body, and my soul. May my breath be a source of gratitude in my life. We'll pause for a moment to breathe. An adaptation from the book of Ecclesiastes. For everything there is a season, and a time for every experience under heaven, a time to be born and a time to die, a time to grow and a time to shrink, a time to lay seeds and a time to taste their fruit, a time to hurt and a time to be well, a time to give comfort and a time to grieve, a time to share and a time to receive, a time to love and a time to be loved, a time to study and a time to germinate, a time to work and a time to rest, a time to sail and a time to drift, a time to pause and a time to rush forward, a time to pray and a time to hold back from praying, a time to ask for forgiveness and a time to forgive others, a time to be angry and a time to let go of our anger, a time to defend and a time for peace of the brave. So many times, so many moments, so many emotions, so many opportunities, so many lost, so much complexity, so much loss. It has been a year of times in ways that we could have never imagined. And we don't leave them behind, rather we take them forward with us. And we use them as a source of remembrance, of love and of honor, of mourning and grief. We bring them forward with us into the world. A prayer was written this past year by a colleague, Rabbi Naomi Levy. When our burdens seem too heavy, we come to you, O source of life, for your gracious help. You dwell within our hearts, you feel our distress, you know our pain, you know how burdened we are and have been. Give us strength to bear our burdens with courage, with wisdom, with grace. Help us to be true to our better selves, to discern our real work in life, and to do it with all of our might. When we struggle within our hearts, stay by our side. Then we will be able to say the words of the prophet, "But those who hold fast to the eternal shall renew their strength. They shall be mount up on the wings of eagles. They shall run and not be weary. They shall walk and not be faint." May our work, may the ties that bind us, each of us, to our family and to our friends, to our community, to the divine, make life rich in meaning for us, so that we may live each day with purpose, so that we may remember all those who came before us with honor, and so that we may take one step closer toward each other and toward you. I'm going to sing this prayer of healing in Hebrew and also in English. Feel free to hum along or just to listen and let the words wash over you. Mi sheberach Avotenu Mikor abracha limotenu. May the source of strength, who bless the ones before us, help us find the courage to make our lives a blessing, and let us say, Amen. Mi sheberach imotenu Mikor abracha lavotenu. Bless those in need of healing with refuah shelema, a renewal of body, the renewal of spirit, and let us say, Amen. Those words that were written by the late Debbie Friedman have been a source of anchoring me in the turbulent times of the past. And as we continue moving forward, we pray for wholeness. A prayer by Alex Weissman. O world of miracles, you are supremely broken. Your shards are painful and cutting. Your pieces are scattered across the globe, aching for wholeness. We seek justice and peace in you. We long and love divine sparks igniting fires within us. We tend the embers and feed the flames, at times nearly consuming ourselves and our neighbors. We pray for, no, we demand open-heartedness and resilience. We seek grace and peace. We pursue justice. May the fragments of our world and the brokenness of our souls be blessed with strength, wisdom, and compassion. May we be whole again quickly in our days. And we'll conclude with the words of the Psalms. Psalm 89. The words are Olam Chesed Yibaneh. I will build this world with love. Olam Chesed Yibaneh. I will build this world from love. Yadadai, dai, dai, yadadai, dai. And you must build this world from love. Yadadai, dai, dai, yadadai, dai. And if we build this world from love, yada dai 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 yada dai dai. Then God will build this world from love. Yada dai 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 yada dai dai. I will build this world from love. Yada dai 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 yada dai dai. And you will build this world from love. Yada dai 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 yada dai dai. And if we build this world from love, yada dai 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 yada dai dai, then God will build this world from love. Yada dai 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 yada dai dai. Let us join together for one more collective deep breath as we move forward, knowing that we have each other to do this work together. Thank you.
Thank you, Rabbi Corey Helfand. Good afternoon, everyone. My name is Dana Johnson. My pronouns are they, them, theirs. I am one of the co-chairs of San Mateo County Pride Initiative and an LGBTQ commissioner. I would like to introduce to you San Mateo County Poet Laureate Eileen Casanedo for poetry selection, Love in the Time of COVID-19, a Speak Poetry project. Eileen?
Thank you, Dana. Thank you, Rabbi Helfand, for the moving and beautiful message. Thank you to the Community Town Hall Planning Committee and especially Francis Lobos for inviting me to speak today. I also wish to thank the San Mateo County Board of Supervisors for their continued support throughout the pandemic. My work as Poet Laureate is to make poetry more accessible to everyone in the county. And I do that by getting to know our diverse communities and the people who make up these communities. their stories, their struggles, and their hopes for the future, because poetry is about possibilities and what inspires people and moves them to create a better world. A few days after the shelter-in-place mandate, many of my neighbors and people in the county have started mobilizing to see how they can help each other get through the pandemic. A few people started yard-based neighborhood pantries. Others offered to run errands for their elderly neighbors. And there were many who gave away masks. Some people in the community have also started writing poetry to log their days and cope with the anxiety and uncertainty brought on by self-isolation, unemployment, and other concerns. So I thought, why not create a community poem that will give people hope and also support our healthcare workers? I then put out a call to send me lines of poetry or messages for our frontliners. And I said I will put them together into a poem, and I promised that for every line that would be submitted, $1 would be donated to the San Mateo County Health Foundation's COVID-19 fund. As of April 10th, in 2020, I received a total of 125 lines from people from all around the county. But not only did the poem raise money for the San Mateo County Health Foundation, it literally grew wings. It traveled across the US and around the world. It was read at the Mystic Seaport Museum in Connecticut on Memorial Day last year. It was cited in the Alzheimer's Poetry Project in Minnesota, and it was used as a resource by the Montgomery Independent School District in Texas. I also found out that it inspired a young student from the Philippines to recite the whole poem on YouTube. And lastly, it has been incorporated in the Transcendience exhibitions by artist Teiji Terasaki at the Japanese American National Museum in LA, which is on view until May 16, 2021. It literally is a gift that keeps on giving. Before I share excerpts from the poem, I would like to thank again the people who sent me lines and messages so that we were able to create this beautiful, powerful, and inspiring work. Much gratitude to San Mateo County Supervisor Carol Groom, Terry Adams, Lisa Anderson, Jeannie Bax, J. Thomas Beard, Tanya Beat, Chuck Brickley, Michelle Bricko, Jackie Burley, Judy Campbell, Patricia Delara, Debbie Diaz, Reverend Terry Eschelbarger, Birgit Ekman, Aaron and Gina Field, Paul Ferricano, Ivana Hansen, Diane Hendricks, Teresa Kelly, Susan Kokoris, Heidi Loop, Victoria Meyer Magbilang, Veronica Montes, Carol Mukopade, Amy Pabalan, Ann Powers, Tony Press, Anita Ferrin, Rodman, Diana Ross, Lila Strauss, Sherry Sunahara, and Craig Weisner. The poem is titled Love in the Time of COVID-19, a community poem for healthcare workers and other frontliners from San Mateo County, and I will just read the last part. For the inner strength, courage, and compassion with which you serve, our eternal devotion you so deserve. For all sinful, where we are, the tired ghosts of fearful uncertainty welcome the laughter that champions the heart. As help travels at the speed of light to spread hope in desperate times, for the speed of love turns out to be the speed of light. A gentle reminder, be safe, be well, be kind, which is to say, shelter in safety and love. Everybody's home and nobody's alone. Thank you so much for listening.
Thank you, Eileen. I'm going to now move this section of the event over to Shireen Malika Fazli. Shireen.
Thank you, Dana. And thank you, Rabbi Corey and Eileen, for this beautiful opening. I'm Shireen Malakavzali. My pronouns are she and her. I am the Chief Equity Officer for San Mateo County. I'll be introducing a brief activity with you where we reflect together, individually and together, on the past year and think of 1 to 3 words that begin to reflect your feelings about COVID. We're a little over a year since we all were introduced to this idea of COVID and our lives were changed by it. We're going to use a tool called Word Garden, which is new for us, so bear with us. It's available on the web. I'll share the instructions, and Dana will also be putting the link and some instructions into the chat. So if you could click on the link that's provided in the chat, this will take you to another window where you will have the opportunity to type in 1 to 3 words that describe how you feel as you reflect on the last year. Your words will be anonymous and no words will be attributed to anyone or any screen name. We'll be sharing everyone's words on the screen in aggregate. For those of you who are unable to access the link for any reason or are joining via a smartphone or have any trouble at all, please feel free to add your response, your words in the chat. Once you type in your responses, please exit the site and view the main screen again, because we'll be looking at all of our responses together. So I'm going to give you a moment to be able to access the screen, the link, and put in your words. I feel like the opening we had with the meditation and the was really helpful. Okay, and you can see right now that Brenda, thank you, Brenda, is sharing her screen with us. And these are the words that you all have been putting in, and you can see the words that are bigger. Hopeful, for example, are words that have come up a number of times for people. And I see some people chatting in their words also. And you can see as Brenda refreshes her screen, how we see new words coming up bigger, like exhausted and tired. I see grateful. I see angry and fatigue, resilient, refocused, informed, growth, emotional, changed, tired, depleted, overwhelmed, fatigued, weary, emotional, misunderstood. There's a lot of, I think, pain reflected here. There's a lot of relief. There's a lot of learnings, whether they're about partnerships and growth. And I love that the biggest word is hopeful. That's so incredibly positive for this community that's come together here today to share a sense of real hope together, as we also support each other around these other challenges and emotions that are very real from an incredibly difficult year. I think some of us have had the most difficult year of our entire lives together. So I think it looks like, unless I'm going to see in the chat, zoomed out, I see it. Re-energized. Thank you. Community endures. Partnerships and strengthened. Thank you. So unless anyone has any additional words and they want another moment, I want to thank you all for sharing and reflecting together. And if you all have any reflections based on your own review of looking at this word cloud together, please go ahead and put them in the chat so we can collectively see everyone's sentiments about what you're seeing here. Grateful, worried, and frustrated. You see these coming up more. Well, thank you all again for sharing with us here today and being here again on another Zoom, yet again, another Zoom. And I want to transition us to the next speaker, who I have the honor of introducing, the County Health's Deputy Chief Sarija Srinivasan, who has been tirelessly, sleeplessly, I can't emphasize enough just how hard she has been working to serve our community, leading so many aspects of the county's COVID response since the very beginning. And she will share with us some thoughts reflecting on the past year. So I'm going to turn it over to Sarija.
Good afternoon, everyone. Does my sound sound okay? Thanks, Shireen. Thank you, Rabbi Corey. Thank you, Eileen. And a big thanks to the planning committee members, Camille, Lisa, Francis, Tanya, Brenda, Dana, Bill, David, and Christy. For those of you who I don't know, I am Deputy Chief of County Health, situated in our public health team. And as I was putting myself in a mental space to reflect and appreciating how these forums have given us together a place to reflect, and also sharing notes with Chief of Health Louise Rogers, my boss, who was really sorry to miss this opportunity to spend this time with you this afternoon. I ticked through from my calendar, you know, what were some major milestones or memorable moments of the past year together. And just to situate you in my thought process, because my tongue does not roll, as Eileen, our poet laureate, so eloquently sent, but from the declaration of the public health emergency that was issued at the world, national, state, and local levels, to that day when our elders were asked to stay at home, including my mother, who lives 3 blocks from me, followed soon thereafter for my family with a persistent fever she was experiencing that we weren't sure whether it was COVID-19. That day when our public health officers as a collective so bravely took the step, the unprecedented step of the shelter-in-place order that was soon to be followed by the state as a whole and other jurisdictions. The first COVID fatality that occurred in our county hospital, the San Mateo Medical Center, seeing so closely with our teams on the front lines, the ravage of this disease that was so unexpected. That enormous pivot to virtual everything, the Zoom fatigue I'm resonating with.
La fatiga de todos nosotros de Zoom, estoy hablando de las escuelas, de socializar, de trabajar.
Watching our public health team, our epidemiologists, our public health lab that was processing test results and receiving test results for every COVID-19 case in the county, and our communicable disease team hardly hit as they were striving to keep staff and residents safe. Honoring my mom's 80th birthday, having gotten through that fever in a backyard with FaceTime with relatives across the country. No possible way to escape the killings of black and brown people at the hands of the police in interactions that continue, that seem unfathomable for those of us who get to walk or run or shop without ever-present fear, as well as the anti-Asian violence that we continue to grapple with. Accomplishing together collectively as a community, beating back the virus and seeing case rates go down over some summer months that allowed us to do things like eat outside at a restaurant. Marking a 25th wedding anniversary by being able to give to Second Harvest Food Bank in the name of 25 close friends and family members. The overwhelming uptick over the winter holidays that really strained and stressed our amazing hospital partners and staff, and being so grateful to be able to mobilize additional intensive care unit capacity with incredible leadership from our county and with the partnership of many essential organizational partners. And then the awesome hopefulness that the vaccine is providing. I loved seeing that hopeful, as Shireen noted, in our word garden together, the tireless leadership that's required and the tireless conversations that continue to make sure that that vaccine gets to everybody, absolutely everybody in our community. And getting to witness the relief and gratitude, whether it was someone who was at the event center or at a community clinic or in a pharmacy. All of these milestones led me to reflect on what I feel, and I feel loss, lives lost, livelihoods lost, innocence and protection lost as we witnessed and continue to see the pandemic's most significant impacts being borne by those who are already shouldering so much and already protecting all of us. I feel strain. It's taken me a while to admit that. I know that our teams, I know that many of you are partners. I know my family warrants more than what I am or have been able to give. And I do have a level of tiredness that reflects being in a state of relentless absorption of needs that can't be fully met. And coming to terms with that still 15 months in. I feel awe, genuine, sheer awe of heroines and heroes on the front lines that have enabled us to avert death and alleviate suffering and prevent harm in so many ways, enabling so many to hang on and get through and keep striding forward. The scientists and the public health professionals and the medical professionals, the healers among all of you and around the world who've helped us get to a path toward better, the advocates who work for a more just tomorrow, everyone who helps us stay fed and nourished. And that is physically, emotionally, spiritually, the trees that preceded us and stay strong and will outlast us, and the artists who are creating meaning and helping us see what all of this we really can understand, what meaning we can take from it. And I feel grateful with resolve to be working with purpose and in community, to be loved by a family that has embraced a public health mission, to be supporting a team of professionals who are completely dedicated to the residents of this county, and to have the privilege of partnering and working with so many who care so much at a time that it's necessary and continually is inspiring to keep learning how to do better by those we serve. I was also asked to share a few lessons from all of this. I think I still have a couple minutes. And what I'm drawing, and so appreciate what we keep learning through these forums and from all of you and the connections you bring to the communities we serve, that we have to keep focused on the why and for whom. and not lose sight of those essential questions as we strive for speed and quality and equity in getting through this pandemic to a next better. That we have to enlist and support others in ways that can build collective strength and resilience so we can keep on. And to find ways to keep learning from the setbacks and the successes. To keep at the core public health way of looking upstream and following that all the way to the root so that we can avert the loss that we experience together. And to summon love, to really summon love that can overcome fear. There's a wonderful poem I'll put in the chat that Maria recommended to me in the first week of our Departmental Operations Center. And it's titled, "My Esteemed Ones Do Not Lose Heart. We Were Made for These Times," by Clarissa Pinkola Estes. And I'll put that name in the chat, and I hope you all might have a chance to read it. And I really thank you for this space that we have together.
Thank you, Sarija, for your reflections and your transparent and authentic leadership and partnership, especially during these challenging times over the last plus years. I know you have buffered the burden of addressing numerous needs, requests, demands, and navigating the natural conflict that arises between all those various entities while providing guidance and service to the community. It is important for us to take a moment to acknowledge that people, regardless of their titles and responsibilities, are people first, members of our community, and they have families, moms and dads, children, significant others. So again, Sarija, thank you. Greetings, everyone. My name is Lisa Teeler. My pronouns are she, her, and hers. I'm the Executive Director of the Bay Area Community Health Advisory Council, also known as BACHAC. I'm also a member of the REACH Coalition and a member of the African American Community Initiative, which is one of the health initiatives under the BHRS Office of Diversity and Equity. In preparation of our community dialogue, I wanted to take a minute to review some of our cultural humility agreements to establish a foundation for us to contribute to a safe and inclusive space for us to have these conversations. Coming from a place of humility means one is open and willing to listen and learn, and the cultural aspects takes into account and reflects the diverse fabric of our community. So at the top of the list is listen as if the speaker is wise and listen to understand. That's the open part. Practice I statements when speaking, although it's okay to respectfully disagree. Let's try to create a space where people can take risks and also respect others, that there's no pressure to speak. Be disciplined about not making assumptions, that we won't blame or shame. Now this next one, confidentiality, if stories are shared, unfortunately, this is being recorded, so there isn't much confidentiality. But I hope that we create a space where people feel comfortable sharing their stories and that they feel comfortable with their stories being shared, because this will be recorded and posted. Let's have the courage to interrupt if there's something that goes amiss or we've been left unsaid. Make sure that the invisible is visible, that we're welcoming all thoughts, voices, ideas, and experiences. And then also let's pay attention to what moves us. To use oops if we think we've made a mistake, or ouch if something comes across negatively. If there are any questions about that, feel free to put those in the chat. And can we get an agreement? So put that in the chat, that we can agree to these cultural humility group agreements. Great. I hope that we can keep these in mind as we have these very courageous conversations. And now I'd like to transition this over to Francis and Brenda, the DEC co-chairs who have demonstrated outstanding leadership during this past challenging year. Francis and Brenda.
Thank you so much, Lisa. Thank you so much for the encouragement and everyone that has spoken so far. Thank you for creating the space. As we begin, we're going to transition to open up our dialogue and allow everyone to be able to share. Today, I wanted to share some of the priorities that have come up in the last 3 town halls that we've hosted. So as we know, while it's been a year, some of these priorities continue to be important and also have expanded. And so in review, here are some of the identified priorities that came out of these town halls. We heard from both community members and also community-based organizations. And the most common were support with basic needs, financial assistance, mental health services, access to technology, and support with childcare and education, just to name a few. Brenda?
Thank you, Francis, for reviewing our priority list. And we also wanted to share some of the things that came from the feedback that we heard from you and the ideas that you all provided during past events. So some of the things that came from these town hall events, there was some digital support that has been available, such as tablets. There has also been county hotspots for internet access. Mental health support cards are now being provided and distributed. We are also, the county is also providing personal protective equipment. And one way that this is being done is through our Mass Mobile that has been driving around the county, providing masks and other equipment. There has also been a vaccination equity group that was formed. We have been providing some assistance, rental assistance, support with education and with school. DHRS sponsored Workforce Wellness Month that happened throughout the month of April to support our service providers. There have also been a series of informational Facebook Live events to share resources and to keep the community members informed. So we wanted to go over this so we can think about that as we start thinking about the dialogue and as we have a conversation.
Thank you, Brenda, and thank you, Dana. I know in the chat they have been providing a lot of the resources, and they just added a couple of links, and we will make sure to send this out as well at the end of the meeting for some of these resources, specifically in regards to digital literacy and support with technology. We have some information here for the community, so we will make sure to provide these PDFs at the end as well. Thank you.
Yeah, and then to get our community dialogue started, I'd like to introduce and invite Tania Perez, who will be supporting us for today's conversation.
Hello, everyone, and thank you, Brenda. Just want to also say that I really appreciate being in this space as well. And I want to invite everyone now to come in with us, right? So as we've heard from the reflections, this time has been difficult for all of us, I would say. Some of the words used in the word cloud reflect that. And so we say exhausted, emotional. And when we join this with the priorities, we can see, for example, the need for mental health care. There's also been, I think, so much grief in this time in the loss of loved ones, but also the loss of connection. And some of the words in the word cloud reflect that as well, with isolation, right? And then we couple that with some of the priorities that we see, whereas, basic needs. So we've had folks in our community, like Sarija talked about Second Harvest, needing all of these resources. So we really want to think through some of these things. We also, during this time, saw many health and social inequities magnify, where they had already existed. We saw vulnerable communities continue to be devastated by the pandemic, as well as systemic racism that looks like the killing of Black and Brown folk, as well as Asian hate crimes that Sarija spoke about. However, I think we also see the word hopeful. We see love, we see determined, we see some really beautiful, I think, imagery about resilience. And I think that these two pair well. We're a year in, and so it makes sense to be feeling both of these feelings at once and making space for some really complex feelings, I think, that are coming up. But I think before we get started, I want everyone to go ahead and take a minute and just say thank you to themselves and their bodies for making it to today, for coming into this space with an open heart and an open mind, and just for showing up despite being zoomed out, despite all of these things that are happening. And so the first question that we have in talking about folks coming into this space are, what are the impacts that the pandemic has had on you? And so we have a few ways to interact with us right now. So just a brief reminder, you can chat it in, we'll read it out loud. There's a Q&A function that you can use for questions and answers. And if you want to raise your hand and speak into the space, we're also super happy. I think we encourage that avenue the most. And go ahead and raise your hand on the bottom of your screen. And Francis and Brenda will do me the favor of unmuting you. And you can go ahead and share how you're feeling. And the second question, I think, is also, just as we're talking, how have your needs changed, and what resources would you say are necessary for you to meet those needs? So let's think about these two questions and welcome any discussion that anyone has at this time.
And as people are thinking about this and entering this space, I also want to thank everyone, because we did ask these questions, some of these questions in the registration, and we received a lot of information, and some of the feedback that we heard was on some of these priorities and just the overall need for addressing isolation, opportunities for socialization and connection with community, faith communities, for example. The need for mental health services, specifically for children, was something that came up. The importance of cultural appropriate services in response to COVID also came up. So we really do thank you for taking the time to complete that registration questionnaire, because that information will be useful for us as we continue to improve services.
Okay, so I'm seeing a couple things coming through in the chat. Social isolation, outdoor gathering for social support. So those are some of the things that are still needed. So let's talk a little bit about the impacts. How are folks feeling right now? I know we just took in a lot of information, had some really great reflections. How is all of this information sitting with you, and how you're processing a year after? And again, we'll take hands, we'll take chats. Looks like we have a hand, Francis. Linda Lopez?
Yes, let's see, 1 second. Oh, Linda. Apologies, I think no, Linda, I don't see your hand up anymore.
Hello, Linda? Is she unmuted? Oh, Mary. Mary.
You can go ahead and unmute yourself, Mary.
Thank you. Am I on now?
Yes, yes. We can
Thank
hear
you.
Mary. Hi.
So I want to first apologize for sending a message in when I was registering. It asked us, how are we feeling? And so I'm 75. I have an MPH, community health education. So I don't know a lot about specific medical stuff, but what I have just been working so hard on is out here in Half Moon Bay, we've got a lot of essential workers. Just this morning, I talked to a wonderful lady, and her husband, she already was sick with COVID and out for 3 weeks. And then her husband works at a place with more than 25 workers. Somebody just came back from Mexico, had COVID, and made 10 people at the workspace sick. And the husband made her sick again because it's variant, you know, so the medicine she got didn't work. This is going to be happening more and more. We can protect workers by educating them that there is a federal law and a California law. The California one covers any employer who has 25 workers or more, whether the employer, obviously, it's for people who don't have sick leave, or even the sick leave, if it's a sick leave is used up. But the employer must pay a worker if the worker has to take time off because of COVID. Must. But my heart is breaking because our very own health department is not educating people about that. But not just you guys. You know, Jackie Spear, Anna Eshu has got a town hall tonight, you know, but it just makes me nuts. So I don't know how many more times, but I have a flyer here that I was trying to get sent to you guys, but I'm just going to read it real quick. And then Tanya, you just go, and that's it. So there are 2 laws that will give a worker up to 2 weeks or more of their wages in 2020 and or 2021 if he was or is taking care of a child because the school was or is closed, or the child care provider wasn't or isn't available because of COVID. In 2020, the worker will get 66% of their salary for up to 12 weeks. In 21, the worker will get 100% of their salary for up to 2 weeks because COVID was on the premises of the child's school or place of care and it was closed. Once again, 21 is for the employers, mandatory if they have more than 25 workers. The second reason a worker can get paid: the worker was or is taking care of someone who was or is in the situation below. Sorry. In 2020, the worker will receive 66% of their salary for up to 2 weeks. And it could have been anyone close to them that they were taking care of. In 21, the worker will get 100% of their salary for up to 2 weeks, but it must be a family member. 21, I didn't mention this, is a California state law enforced by the Labor Commissioner. 20 was the Department of Labor, a federal law, which hardly anybody knew about. The third thing, if you had yourself COVID or symptoms or were exposed to the virus or are waiting for the test result, and in 2021 for yourself, if you're going to get a vaccination. Out here in Half Moon Bay, there's a lot of people who couldn't take the time off to get a vaccination. And like they worked at McDonald's or Burger King or Dunkin' Donuts, but their employers are not telling them that they're covered with that law. That's the health department's responsibility. If no one else is stepping in, this is gigantic. And I brought it up to other webinars and deals that happen on the computer, and nothing happens. And it's just heartbreaking to me. There's a whole bunch of other stuff, but I don't want to waste time unless no one else raises their hand. I mean, there's other problems, but this I think is the most gigantic. And also, please, no more places having testing that is only during the daytime, which is exactly what Trump wanted, because then he didn't have a lot of positives. And vaccinations, for God's sake, do it in the evening or weekends, because once again, our essential workers are people working the hardest. They don't know they can take that time off until you guys do a massive publicity campaign. The Spanish media is telling people, but the Anglo media has to tell people so that the Spanish-speaking community isn't sticking their neck out with no support from their compañeros, you know.
Yeah, thank you so much, Mary. I really appreciate all that you've shared. I think that I think I've been in other online spaces with you, and you're doing tireless work for the coastal community. And I think that that's amazing. And I think that what you're pointing to are some of these social inequities and social determinants of health, of what it is to be an essential worker, and being able to launch a communication campaign that informs people about their employer rights and their employee rights and all of those things. And I think that we have a little bit of information, I believe, from Legal Aid, perhaps, who we've partnered with, and they've shared Spanish and English information with us, so we can also make that resource available. But I think you're absolutely right. And as far as evening clinics for vaccines, we are starting pilots for evening clinics that I'm really happy about, because I think what you're saying is completely true. There's a lot of folks that cannot get to a clinic during the day. And we also have expanded clinics for vaccines and testing to the weekends in some areas, and we're hoping to expand on those efforts, but we're definitely thinking of folks that are not able to make it, I think, during the daytime. But thank you so much for always bringing those things up and letting us know. And this is something, we use these forums, right, to collect information and take this information back. And so we hope that the next time we have this, we're able to share with you back the efforts that we put forth because of your feedback. So thank you so much for participating.
Tanya, thank you so very much. Thank you. And I'll send you stuff, you know, which I never got this thing boiled down yet that I read to you, but, and URLs and the attachments of the one-page posters. Excellent.
Of course. Yeah,
Thank
thank
you.
you so much. Thank you so much, Mary. We really appreciate it. Anybody else have anything to share? And so now Mary has kicked this off into talking about some of these social determinants of health, for example, and how a lot of these accessibility and problems that we were seeing even pre-pandemic, like we talked about, are being magnified now. And so this is also the space to share some of those worries and some of those impacts that COVID-19 has had on you. It doesn't have to be, I think, personal. It can be things that you've noticed within your community. And as a person that perhaps has more privilege than other folks in your community. Anybody else?
I see that Linda is raising their hand. And now they put their hand down again. But I'm going to go ahead and unmute you, Linda, in case you would like to speak. Just give me a second. Okay, Linda, now you can unmute yourself if you'd like to share.
Okay, is that good now?
Yes, we can hear you.
I think the one thing that is coming up, I continue to meet with all of the, with a lot of the coalitions that are serving South County, San Mateo, East Palo Alto, Bellhaven, and North Fair Oaks. And one thing that is coming up across the board is the level of stress and anxiety is escalating and will continue to escalate because of the eviction moratorium ending in June. And so that's just giving everyone a heads up on that. And just as we organized and strengthened our partnerships and formed coalitions to provide information to each other and updates and also plans to help people survive, we're going to be doing that also around mental health. So I just wanted to put that out there. Thank you.
Thank you, Linda. We really appreciate it. And I think mental health is definitely a priority that we're seeing based on all of the information that were collected. So thank you so much for those efforts as well. The next thing I think we have is, let's look at, Gloria Garcia, would you mind sharing? I see that you shared with the chat, but that only went to us, the panelists. So talking about direct connection with clients living with fear, change, losses, responsibility to continue to connect. And so Gloria, can we hear a little bit more from you, please?
Sure, thank you, Tanya. Well, I'm just in terms of the impact. Wow, it was.
Just trying to hear her.
You can't hear me? Can you hear me now?
Yes, we can hear you, Gloria.
Okay. just in terms of the impact, and really, it took us a minute to realize that this was an ongoing and a very serious thing. It just made your head spin. But it also meant that we really had to make connection with our clients. We needed to make those connections because we know of the isolation, the loss of jobs, the loss of so many things, including whole families contracting COVID. So that human element was very, very critical for us, and it got more serious as time went by. But it also, for me personally, I felt like I wanted to be out there and help. I mean, this is my life. And I couldn't because I was over 65. I was told that I could not. I had to stay in. So it was. I think it's just been difficult, but we've learned a lot of things between this time, and I've seen a lot of hearts open up, and being able to be a partner with other community organizations and other wonderful people who have that same passion for community have come together, and it's just been a real gift to see our community become active and really participating, because we have a history of being left out. And I think this conversation is very timely, and I'm grateful that that I'm living in this time and space in which we can continue creating a better world for our future.
Thank you, Gloria. And just as a follow-up question, I think, you know, sometimes when we're folks that serve others, we think of ourselves last. And so do you mind sharing with us how it felt to not be able to be out there doing the outreach that you're used to, and how that might have impacted you as well, if you feel comfortable sharing that?
It's hard. It's hard because none of us do anything alone. We need each other. We need each other, and I'm used to being out there. I'm, you know, it's part of what we do in community, and so having not being able to do that. The work is still there, so
Yes.
you're not sitting up there pouting, or you don't have time to pout. You have only to serve. And so I felt strange not being able to get out there, because you just used to your life is just doing what you have to do, and being out there to serve. Connecting with people is so important, and being able to fill those gaps and be that lending hand. So that's strange. That was strange to me.
Yeah. And Gloria, again, thank you. I think so much. You do so much for community and so much for the community of East Palo Alto. Really want to give our thanks. And I really appreciate that you were able to make that decision to take care of yourself too, right? And I think that's also what this reflection is, right? On how, we make it after a year out. So thank you so much for sharing, Gloria.
Absolutely. Thank you.
Yeah. The next person, we see another hand raised. So Kalima, can someone please help me unmute her, please? Thank you.
Hello?
Yes, hello, we can hear you.
Hi, my name is Kalima Slahudeen, and I am also part of the REACH Coalition with Lisa Teeler, and a board member with the Jefferson Union High School District, and I serve on various county COVID committees. And so the one thing, I spoke on the last town hall. I was a panelist on the last town hall. And at that town hall, I spoke a bit about the systems that are in place and how they haven't really been targeted or haven't helped service communities of color. And that COVID really shone a light on that. And So the thing I want to speak to is just continuing that light. Really, the thing that's made me keep the faith is how many people of color I have seen speaking up, working together, the resiliency of our communities and how they all stepped up and helped support each other, sometimes with little to no help. And I want that to continue. I want us to continue to shine the light on the inequity and the need for continued support, because the term I hear a lot being said now is that there's a light at the end of this tunnel. For a lot of our communities experiencing the trauma that they went through because of COVID-19 and with people being sick and also the loss of family, a lot of their darkness has just begun. So I know there's a need for a lot of people to move on and really get past this, but I want to also say that a lot of people, their journey through this is just beginning. And that when we talk about mental health, really talking about ongoing continued mental health for these communities that bore the brunt of the COVID-19 crisis, ongoing supports for the community, and continued voices from these communities, and the need to get more of our voices in leadership roles that has never been more apparent than through this crisis, that we need to get a variety of people from a variety of lived experiences in leadership roles in every area of the county, especially in our Board of Supervisors. So I'm hoping that this is an ongoing conversation, that we continue to work and stay united. And, you know, I'm grateful for this space. Thank you.
Thank you so much for sharing, Kalima. And in the same vein as we asked Gloria, right? How has the pandemic impacted you? And what are some of the things, you know, personally, I think we want to open the space for vulnerability if you're open to it. If not, that's perfectly okay, and like authentic sharing. But I think you'll give us a lot of things to think about. And I think that when we talk about, you know, anything systemic or anything structural, these are things that endure, right? And it's one thing to be resilient, and it's another thing to be respected. And so I really appreciate you making that distinction for us, and using this platform, I think, to also share. And I do remember you sharing in, I think, our second town hall, where you so, I think, succinctly phrase it that some communities are bearing the brunt more than others, and that still proves to be true. So just wanted to circle around if you wanted to share, I think, how you're feeling, I think, a year after, personally.
So I think it's been a year of really high highs at seeing the successes that have taken place, and really low lows of seeing how slow things have moved and lack of progress, and things that I feel that should have been learned that still have not been learned. So it's just a reminder to me of how much work is still needed to happen, and that we didn't get here yesterday, so we're not going to get out of it tomorrow. It's a marathon and not a sprint. Mm-hmm. That I have been super blessed. Like Lisa just talked about how I'm a gift in the chat. She has been a gift. I am super blessed with the allies that I have gained, and the friendships that have been formed, and the bonds that have been formed through this, that I have met people that I will stay close to for the rest of my life. And those are the things that I hold on to. And it's also reaffirmed my commitment of my why, about why, you know, my mom asked me, why do you give up so much of your time to do this stuff? And that seeing the outcomes of working together with everybody, it's so many people that are on this Zoom, is the why. And also really showing who we are as communities, because I think we're often discounted about, yes, we need support, but we don't need to be talked about and talked to. We need to be talked with. We need to be listened to. We need to be allowed to support, and the work that's already been happening but just not been supported, we just need to be lifted up. We don't need folks to come in and do stuff for us or tell us how to do things. I think we just need to be supported in the work that's already been ongoing, and with the fight and effort that's already in place in so many of our communities, but just is not recognized and often goes unseen. There are so many unsung heroes that a lot of us in a lot of our communities would not be here without these people that are often aren't recognized. And then the last piece of this is just not allowing ourselves to be used as political pawns. You know, I'm not here to make you feel better about yourself. That people need to be authentic in the work because that's what we deserve.
Thank you so much, Kalima. And there was so much there, right? And you teach us so much, I think, every time. And we learn so much from community. And you know, this really need for partnership, right? Authentic partnership. And we thank you and all of community members, I think, for being patient with our missteps, but also really still wanting to partner, I think, with us and to be able to come out of this together better, right? All together better. I wanted to also make a little bit of space for folks that have put some things in the chat. So the next things, Susan Takalo talked about the need for food that has increased dramatically. I'm concerned that things will continue for a long time now that rents are coming due with government support ending and the rental moratorium. So we really thank everyone for sharing these comments. Another comment that we got was, it would be great to have a better understanding of funding that's available for county residents and individuals who are struggling financially. So making that a little bit more available. There are many neighborhoods that have been ravaged by COVID, and the restaurant, hotel, and other service industries. And because of this, we know that it is a lot of communities of color that are being talked about in this. We have another hand, so we're gonna take a little pause from the chats. Linda Lopez, can I get some assistance unmuting Linda, please?
Linda, please go ahead and unmute.
Unmute. Okay, there I am.
Hi, Linda.
Hi there. Just real brief. I'm sorry, I missed the name of the previous speaker, but I agree 100% with her.
Oh, Kalima.
Kalima. Thank you,
Yes.
Kalima. Absolutely, the issues, problems are historical. And we've said that time and time again, that there were, as the medical term, pre-existing conditions prior to the virus coming into our lives last year. My concern more recently is the amount of data, the research and data that is being solicited for additional research and data on, for example, basic outreach I think that's my definition of being a political pawn. And I too don't want to see us in that arena, but it seems like there's an onslaught of consultants coming in to get additional research and data on issues that have already been researched, and there is data. The health department has spent a lot of time with doing some excellent research and data, or data rather, on, for example, on the health aspect. So it's like, I start to feel like the community is under a microscope, and it's a little too much, only because there already exists. There's no reason to reinvent the wheel. There already exists substantial, sufficient research and data on what the issues and problems are. And now we have to go to the next level of actually coming up with strategies and solutions and buy-in buy-in from the county. Thank you so much.
Thank you, Linda, and thank you for sharing that with us in transparency. I think if, we take account historically how communities of color and vulnerable communities have been used in research, I totally understand, I think, where you're coming from. So that is something that we will be documenting and I think further thinking about as well. I want to make a little bit of space for the chat again. So Kari, I don't know if you want to speak up or if you're still here, but I'll go ahead and read some of the comments. I think our outreach efforts in many of our community programs are still evaluating what a good hybrid model might look like moving forward to support both in-person and online/phone engagement activities. There's an opportunity for continuing these hybrid models in ways that support and engage people in more ways that work for whatever their situation might be, highlighting best practices for doing this well for meetings, outreach, and direct services would be very helpful. Yes, and so I think that best practice sharing is definitely something that we can definitely aid in, and something that we continuously do as well as a county. And so the next thing I have here, okay, so Kari Chan. Okay, so curiosity about best practices that people are looking at is another comment that we're getting. And so if folks have best practices, that's also something that people might want to connect on. But anybody else about the impacts the pandemic has had on you personally, and have the needs changed? And what resources would you say are necessary for you to meet those needs? And we have a hand. Friends Marie. Francis, can I get some help, please?
Please go ahead and unmute yourself, Franz Marie.
Hello?
Yeah, thank you. What has it impacted me on, or what impact it has on me? It's prevented me from travel. That's been huge. I don't think that that's something that obviously we're all hindered by, but if that's anything, it's not about personal or mental or anything. It's that it's impressed upon control on where you go and how you do things.
Thank you for sharing that, Friends Marie. I think when we think of grief, sometimes we don't think of some of those tangible things, like traveling, right? Being able to go somewhere and take a break, I think, or even just the act of planning a vacation, I think is something that gives people joy. So thank you for also highlighting that and bringing that to the conversation. Anyone else? Or do we have anything in the Q&A?
We don't have anything.
No? Okay.
We have an opportunity, Tanya. I see a comment here in the chat from Priscilla Romero.
Yeah.
I see here, I don't know, Priscilla, if you want to chime in, but Priscilla wrote, it would be great to have a better understanding of any federal funding, state funding available for county residents, individuals who are struggling financially. There are neighborhoods that have been ravaged by COVID and the restaurant, hotel, and service industry closures.
Okay. Thank you, Francis. I think we just got also another. So Priscilla, would you want to speak up in this forum, or did we capture it well via chat? We'll give her a minute. Okay.
Sorry, my mic wasn't working.
Yeah.
I think you totally captured it in the chat. I mean, it's really sad, right? Just driving around like our communities and seeing like businesses closed and boarded up. And when you talk to folks, there's just like someone said earlier, right? Like for some folks, as they've been vaccinated, it feels like there's light at the end of the tunnel. For other folks, it doesn't feel that way in their journey with mental health and depression and anxiety is just starting, or it's starting to just kind of cave in and spiral out of control, right? And so if we can sort of just have a process that's a little bit more clear and transparent on how to access those funds. When we go to the San Francisco site, it's pretty clear. like the steps that need to be taken. And so if we can mirror that, that would be great. I'm hearing that a lot from communities like, in the South County, but also in Daly City and South San Francisco.
Thanks, Priscilla. I really appreciate that. And how have you been impacted yourself by the pandemic, if you don't mind sharing?
It's been hard, right? It's sorry, I've lost a lot of family, and so and then there's also a lot of folks who don't want to get vaccinated, and it's really frustrating and saddening to me. And so, just really staying positive and always trying to showcase, like Dr. Chan said today, right? Like, this information is really dense to digest, and it's really scientific, and it's constantly changing. So really joining, really being transparent about that with my family and like community groups that I'm close to that ask me, and for me not to be like judgmental and just hold all of my emotions and put them aside and say, this is the information as of today at 4/29 on 4/29/2021.
Yeah.
And creating this openness around the communication, and that yes, I stand by the vaccine, and but not everybody believes in it. And so I think I was talking to someone yesterday, and they said, it's great to really, you never know how you're gonna convince folks, right? Some folks it takes facts, some folks it takes a narrative, a personal narrative. Sometimes folks need a combination of things. And so really listening to what people need, and it's all based on individual needs. So it's hard sometimes from a public health perspective, because we look at population from a population health lens,
No, yeah. And thank you, Priscilla, I think, for sharing that and for being vulnerable in this space. Our heart goes out to you and your family for the multiple losses and the grief that you're holding, while also, being someone that works in public health, right? That serves our community. So we really appreciate you being here and you sharing. We do have another hand. Christina?
You can go ahead and unmute yourself, Christina.
Hi, good afternoon. I just wanted to piggyback on what Priscilla had said. I jumped off to answer the phone because my brother was calling, and he said, "Hey, I saw that San Mateo County has a vaccine clinic, and there's nobody there right now that is getting the vaccine." So we've come to that point where, and I know that they've been telling us, on the news nationally, that we were going to get to kind of this tipping point where the problem wasn't going to be enough vaccine. It was going to be demand, that we were going to have the vaccine, but not enough people that were wanting the vaccine. And I think that that's really where we're at now. And so for almost a year now, since May of last year, I have been working with the Public Information Office with the Communications Health team with County Health. And what I've been then grappling with and then bringing to the group is where do we go from here? Because we're really turning the page. We're at a different point now than we definitely were a year ago. And with respect to the vaccine, what I just told my brother, and I've been telling, I told one of my other team members earlier today, and and I keep telling people, is that I think that we're coming down to the last hardcore group. We have a lot of people that have been vaccinated. We have really good vaccination rates overall in the county. they could be improved in certain areas of the county, but that's what I mean. I think we're down to the hardcore group, those that don't want the vaccine because they're scared, or those don't want the vaccine because they've been misinformed. Those that don't want the vaccine because they don't want any vaccine. It doesn't matter whether it's COVID. It's just they're against any vaccine because, I don't know, because it's from the government. And some people think that there's so many conspiracy theories. I don't need to bring them up here. It's like we've all heard the conspiracy theories about vaccines. There's the group that's homebound. And I've been hearing that a lot, like, oh, what happens with the people that are homebound? There are young people. So that's what I've been hearing. So the younger people that have been carrying the burden of getting more disease, so they might not be the ones that are get the sickest or end up dying from the disease, but they pass on the disease to other people who can get very sick and end up dying. But the younger people, I'm hearing that there's a lot of hesitation with the younger people about the vaccine. So that's, I've just been trying to grapple with, like, okay, so, you know, like now what? And when we look at behavior change, right, for any type of behavior change, there's going to be people all along that paradigm, those that are right there, like, yes, I want to change. I want to do that, like right now. What is it that I need to do? All the way to the people that are just not even ready yet. So all along that spectrum, we have people all along the county. And so what is our next step to be able to help our population? It's so if people have suggestions on messages, ideas to get out into the community, I would so welcome that, because I think that we really need to kind of shift the tide in the messaging that we're doing from public health, and just like really target it now to that community that we're hoping to inform or maybe kind of sway, so that we can all see that light at the end of the tunnel, so that we can all start to feel hopeful, because it feels like we're starting to come out of this, but it's like we're on the brink, you know. It's like it's do or die now, you know. Are we all gonna hold hands and go through this together, you know? And you don't want to leave people behind, right? That's just like, in my way of thinking, we all want to get to the finish line together. It's so, how do we do that? How do we all hold hands and try to get across that finish line without, you know, having to feel like you're dragging people or that you're leaving people behind?
Yeah, thank you, Christina. Thank you for those comments. And I can provide a few comments, I think, on that. I think as we see vaccine supply increase, we are increasing how we do outreach. And so we do have a few initiatives that have come out of the Vaccine Equity Work Group, and for some high touch outreach, as well as some of our trusted partners have also put some of those RFQs out as well. So we're definitely thinking on how to do that. And as far as homebound folks, we do have a process for them that is, I think, and we're making progress. So I do want to assure you on that. And I'm happy to also give more information on that later on. But thank you so much, Christina, for all of those comments and you know, the resolve of not leaving anyone behind. I really appreciate that. One comment from the chat, and then we'll go over to hands raised. Marion, we see you. Hopefully I pronounced your name right. One comment that we do have is regarding data. And so as far as the number of behavioral health crisis calls that police respond to, and whether that number has increased during this time, because we believe that it may have. And so that is something that we don't have available right now, but we can definitely look into. I think overall mental health needs have spiked and skyrocketed in VHRs. I know we used to call them like the two pandemics. And so before, I think it was about 1 in 10 people had some type of mental health challenges. And during the pandemic, we saw it to increase to 4 in 10. So that's definitely an increase. So thank you for bringing that up, Martin. And so Marianne, Francis.
Marianne, you can go ahead and unmute yourself.
Okay, good evening. My name is Marian Brown. I work with Lisa Teeler in the Bay Area Community Health Advisory Council. I'm listening to all of the speakers, and it's just so overwhelming to hear. Mostly there's questions and misunderstanding, especially about the misinformation that we're getting, especially as I'm an outreach specialist, and we need to be able to give the people we are outreaching to better information. And I'm gathering information from one place or the other, a hospital, my own health clinic, the vaccination and testing clinics that I'm working in. And there's like no general resource place. For instance, how people will come into the center or their health center or a clinic and be able to sanitize and, math, everything, things like that. It's not standard. There's no standard or real standard that I can see. And then I can't touch on everything, but about the political pawns, to me, it just seems like there's a lot of back and forth with the county supplying us, the small or the CBOs, they supply us with, a few things, but not enough information. I don't know, it's confusing to the people who feel that they have to come in and get vaccinated, and they may feel like they're being herded in without enough information. So I think the switching back and forth with funding, like the speaker before me said, I think it was the San Mateo County Event Center, huge opening, a reopening, and only 300 people showing up, and they had tons of vaccinations. And then you look at the news and there's India. They're devastated. Just so much confusion. And where is the centralized information or centralized resources? Yeah, I'm just feeling all of this is overwhelming.
No, yeah, and thank you, Marian. And I think all of what you say, all of your feelings are valid. And I think that in terms of communication, things have been difficult because our supply has been fragmented and has been short, right? For such a long time that we had very small windows to work with. And now that supply has increased, I think we also feel very hopeful that we will be able to employ a lot of these strategies and have communication. I think that reaches more folks. I think we also see in the chat that tons of folks still want to get vaccinated, but it's hard for them to get to the sites, or they're open during business hours, or there's not enough notice, right? And so there's all of these structural things I think that we're working. Like I said, we're trying to pilot nighttime vaccine clinics, I think within the next week, and definitely taking all of this feedback and internalizing it and operationalizing it as well. And it's great to hear, I think, from someone who does outreach and cares so deeply about their community. So thank you for sharing this space with us. I know that you're being heard. So thank you so much for speaking up. I think the other thing we have, do we have any other comments in the chat, Francis? Oh, I see one more. Oh. Do you want to take it, Francis? Or
are you referring to Kari Chen?
Yes. Yeah.
I see it. Thank you. So Kari says, thanks for these resources. I've personally made outdoor home visits to help seniors at our church and other neighbors get comfortable with their computers and then get on Zoom. Once they get on Zoom, it opens a whole new world to them, but until they can get on, it's very hard. Just recognizing that the digital health literacy trainings require Zoom access. At our church, we have an elderly developmentally disabled couple that has been very frustrated and uncomfortable using anything beyond a phone. We offer to provide them with a computer or iPad to provide training for them to access our church community and other services, and they have refused those options. They have difficulty focusing and understanding when someone is not in front of them. I worry that there are many others like them that have also been lost over the last year because using technology available, an online Zoom option would not work for them.
Thank you, Francis, for reading that. I think that's incredibly helpful. And you know, it's one of the things I think that we're still working on is the digital divide, and how we've seen that come to play and surface, right? And some of the resources that Francis shared earlier were about Painted Brain. And so out of these town halls, we've created events, right, where older folks are able to get trained on Zoom and on using smartphones and all of that technology. So please look at those. Please share them with loved ones. I know that my parents have had a difficult time, I think, with online interfacing, and they're very social. But I really appreciate all your work, Kari, and being so hands-on with your neighbors. And I think that the pandemic has taught us that, right? That there's this interconnectedness that we definitely see. There's this care, I think, that we've put into our communities that is now live, right? Folks that weren't able to get to vaccine appointments before have their neighbors scheduling for them, people offering rides, and communities coming up with networks as well. And we're completely astounded at that resilience, but also know that we are able to provide more resources in order to make this more accessible to folks as well. So please check out the Painted Brain events. If you have loved ones that need any digital tech trainings, yes. So anyone else with a hand raised?
We're moving to the next segment. I know
Okay.
we still have a lot to talk about. If we didn't get to hear from you today, or if you had something else that you would like to share, we will share contact information at the end of the event so we can keep this conversation going. We are holding these conversations as well on a monthly basis at the Diversity and Equity Council monthly meeting. So thank you all. At this point, big round of applause, virtual round of applause for Tanya.
Oh, thank you everyone for sharing. I really appreciate it. Thank you for coming into this space and being vulnerable. I really appreciate everything that was shared today, and know that we are taking your feedback back and trying to operationalize it, and we'll hopefully come back at the DC or in another forum and be able to show some of the things that your efforts contributed to making us better. So thank you so much to everyone that shared this space with us today. I really appreciate all of you.
Thank you so much, Tanya.
Thank you so much, everyone. Just to echo what Tanya and Francis were saying, thank you so much to everyone that showed up today, that contributed to the conversation and help create such a safe space for everyone. Thank you. So we're gonna move on to the closing portion of the event. And for this, I would like to introduce Jonathan Stager, who's gonna lead us through a closing ritual.
Thank you, Brenda. Everyone, I would like to invite you to close your eyes for a moment. And just, you're sitting or laying down, let the chair hold you. A lot has taken place, a lot of feelings, a lot of expressions, a lot of emotions, hopefulness, feeling tired. Allow yourself to really feel this moment, how you feel. And as you can, take the label off of the feeling, the emotion, and just experience without a label what you feel. Not a good thing, not a bad thing, not a right thing, not a wrong thing. Just allow yourself the experience and connect with the inhalation and the exhalation. Just that simple. As you let go. That light at the end of the tunnel, you are that light. You are that resource. Allow. And now gently open your eyes and experience your room where you are. Take a look around for the first time. Let it come to you. Just let your thoughts, your feelings, your experience, let it come. Without labeling, without making it anything, just experiencing. I'm very, very, very grateful to you for just being here and expressing and sharing. Even if there were no words, your energy was present with each person that did speak because you were listening. And it's felt. We all make a difference in just being. So Brenda, if you could play the film. This is the Tao Te Ching, and it's verse 59. As energy unites mother and child, the eternal flow from the Tao brings forth reality, nurturing, sustaining the tension that holds everything together as one. Hold that tension. Feel the presence of the mother. Every child knows the mother's voice. Embrace the totality of her being to awaken unlimited possibilities. To lead humanity while serving the Tao, nothing steadies the journey better than being minimal. It is a balancing act, this dance between existence and the Tao. Being at the right place, at the right time, the right action is revealed. Be like the Tao, fluid, receptive, open to all possibility. People become tangled in the desire to be expansive, to bring benefit into the world and toward themselves. Yet, when a vessel has been filled, it is of little use if all the emptiness has been consumed. Leave room in your life. Being true to the Tao takes patience and restraint to resist doing in order to awaken being. The sage expresses herself with readiness and deliberation, gently opening herself to new possibility as a butterfly, awaiting transformation. When one pursues the Tao, eternity is the prize. It takes skill to be humble, to be thrifty, doing less rather than more. Free yourself from the ambitions of your mind. The Tao may be indifferent to your actions and ideas, but the world? That is quite another matter. The menu of existence offers unlimited possibility. Learn to be frugal, discerning. Temper your exuberance. It takes practice to be firm, yet flexible in meeting new attractions. Be selective. Learn wisdom from economy. Exercise restraint. When to act, when to speak. Virtue is born in silence, not speech. Virtue is sustained through inaction, not doing. If you are virtuous, people will believe you can do anything, that you have mastery of the universe. A steady course set to the compass of the Tao yields a long journey. This is called tapping into the deep root. This is the path of return to the mother of all being. To serve the affairs of humanity, be humble. To serve yourself, choose wisely. To serve the universe, let go of everything. Just be.
Thank you so much, Jonathan, for that. I think that's what we all needed to end the day today after our conversation.
Thank you, Jonathan. That was beautiful and what we need today as we close out. We have some information here, and I just want to again thank everyone for attending. We're going to launch a very quick poll with 3 questions to get your feedback on how the information was taken today, what we can do better, what more information we can bring to the group. And on the slide, you'll see some resources if you are looking for mental health and substance use services with the county. We have the Access Call Center number here. We will be providing this after the meeting as well, so no rush to get all this information down. For more information on COVID updates and data, we encourage you to visit smchealth.org/coronavirus. And as we're filling these questions out, we also want to remind you that May is Mental Health Month. And we have a calendar of activities that you can participate and take part in. We will also be sending out this information to everyone. But just a big thank you, big thank you from our team for being here and sharing this space with us today and being vulnerable with us. Brenda?
Thank you, Francis, for sharing that information. We also welcome any additional comments or feedback that you would like to provide. You can see on the screen the email address that you can send that feedback to. This information is also being shared in the chat box and will be made available to you after the event as well. You can also join the email list to stay updated and informed. And we also want to invite you to be part of and join our next Diversity and Equity Council meeting. We meet every month on the first Friday of the month from 11 a.m. to 12:30 p.m. Meetings are open to all community members. We are meeting virtually. You can find the meeting information on the screen, or you can reach out to one of us as well for more information. Thank you all so much. And actually one last activity before we all go and log off for the day. We'd like to invite you and share with us in the chat box, what is one thing that gives you joy or hope right now? I see some responses. I hear summer, music, cats, pets, community space, yes. Peace. Someone said shine class, community. Friends, signs of the time. Friends, comic books.
Giants,
diversity. Baseball, Giants. Christina just shared my new granddaughter. Activism, President Biden and VP Harris administration, yes. Gathering with friends, yeah. So, now that more of us are getting vaccinated, we feel more comfortable sharing space and being in person with loved ones. Gathering with my friends and family. Oh, I just read that one. Seeing family members again, yes, absolutely. Yeah. Thank you so much, everyone, for being here. Food, yes.
All right. Thank you, everyone. Thank you for joining us.
Thank you. Uh-oh.